You're back at ECCMID TV here in Madrid 2018. I'm Christoph Specht, your host, and believe me or not, I'm a little bit nervous now because I have the honor, the next interview guest is nobody else but Dimitrios Kontoyannis, professor in Houston. You are one of the awardees of the prestigious Excellence Award in clinical microbiology and infectious diseases. First of all, congratulations.
Thank you very much.
You've just been presented the award,
Yes,
is that right?
yes.
How do you feel?
I feel very honored and very reflective of all my career and all these accomplishments of the field. In my name, what is recognized is a big area of infectious disease and a lot of advancements in the area of infections in the immunosuppressed host. So clearly, my work is based on a long series of achievements of other people, and I'm very honored to be a part of this legacy.
Tell us a little bit more, how did you get into this business, into this field?
Yeah.
Mycology is your special interest. How did you get into that?
Mycology is a rather esoteric field of infectious disease compared to very well-known areas of bacteriology or virology. I went there by serendipity. When I came from my home country, Greece, I started a research fellowship at MD Anderson, where I practice now, and that was the available opportunity for me to do research, and I started and I got fascinated by it. Fungi are eukaryotic organisms like we are. We're not bacteria that are prokaryotic, have a lot of tricks, a lot of genetic plasticity and a lot of sophistication, how to evade immune responses, how to become resistant to antifungal. So there is a lot of fascinating biology, immunology, and they have emerged as a main causes of death in highly immunocompromised patients because we have very good bacterial and viral medication. So clearly one of the modern frontiers of infectious disease in patients with weakened immune system is opportunistic fungal infections. So that's my main area of focus and research.
I don't know what your comment on this would be, but to me it sometimes looked at microbiology, especially mycology, has a little bit of shadowy life or existence.
Yes.
Not only in the field of microbiology, but especially in the field of medicine as a whole.
Yes.
How do you comment?
Yes. So mycology is an area that a lot of people don't know much about it. Actually, it's a very important area in modern economy, ecology, history. There is fascinating stories about mycology. For example,
give us one, yes, please.
Just to give you an example, that in basically space travel, the only creatures that can survive the radiation space travel are fungi. So if you go and culture the Mir station outside, you see fungi growing. So one of the interests of people have is to use fungi as a food source for these major travels in the future, reaching Mars and everything. The only for example, a lot of historical events are around mycology. For example, the potato famine in Ireland, when 1/3 of the population of Ireland migrated to the United States because of potatoes going bad from a fungus. There are so many issues, biotechnologies based on fungi, like antibiotics, vaccines, penicillin, the historical drug that was made by fungi. But also, a lot of people don't know much about fungal disease compared to bacterial infections. Fungi are a very common cause of allergies, common causes of innocuous infections. The lay people know mostly the athlete's foods, the vaginal infections. So everybody thinks fungal infection is something very, very trivial. But in reality, in the immunosuppressed patients are the main causes of serious infections and death. So there is a whole spectrum of what mycology is all about.
Absolutely, yes. And what measures must be undertaken to strengthen this fascinating field of research for the future, for the next years?
Yes, so that's a very good question you're asking, because of the lack of awareness by the funding bodies, the political establishment and everything. This area has been relatively overlooked compared to bacterial world and everything. So I think major emphasis has been to develop fungi as mini factories for developing drugs, so boost the fungal contribution to drug production, improving the quality of agriculture by intervening against fungal diseases of the crops. That's another big intervention in societal function. And for my own area, fungal development, understanding better the pathogenesis of fungal disease, improving diagnostics. It's very difficult to diagnose these infections as well as bacterial or viral infections, and we still need better drugs.
Yeah.
But historically, those diseases, to give you a perspective, 25 years ago, if you got a fungal infection, you had a 90% risk of death because there were not very good drugs, there was no much supportive care. Now, you can have a very bad underlying disease, you can get a fungal infection and your risk of death is 25%. Right. So there have been a lot of improvement, but we're not close to 5–10%.
Yes.
And I think a way to promote interest about fungal diseases in immunosuppressed patients is to make people aware that those infections are indirect causes of death. Because if you get this infection, you don't get chemotherapy, and then your underlying disease is not controlled and you die from underlying disease. Right. So preventing them not only prevent death directly from the fungal infection, but also you prevent a series of downstream events that preclude you from life-saving chemotherapy,
the
control of underlying disease.
Yeah.
So it's a little bit of a mixed bag. And what I talk about in my talk was there is a transformation now in the way we treat leukemia, and we are moving away from this rather primitive way of giving high dose of cytotoxic chemotherapy that induces mucositis and neutropenia to more smarter design drugs that don't do all these bad effects, but also have some some bystander effects to the immune system. So you create some scenarios when the patient doesn't have classic risk factors for fungal disease, yes, yet he has some risk factors for fungal disease because of this immune bystanders effect of those drugs. So in the future, we're going to see a very fascinating landscape of treatment of leukemias on transplant, when you're going to see a lot of targeted therapy against leukemia on transplant.
Specific than it was
specific. That's going to make the fungal disease less, but also is going to create some unique problems in some people who have genetic predisposition to get this fungal infection. So instead of being a broader area, I have neutropenia and I have a fungal risk, it's going to be a niche area when uniquely predisposed patients might have this type of problem. So the investigator of the future is going to deal with very fascinating pathogenesis, immunopathogenesis problems. But overall, I would say fungal infection is a prototype of the improvements we have made in supportive care. We have tamed this type of infections to a large degree, and that's why you see more and more improvement in survivals of patients in leukemia. It's not only the neutropenia, the leukemia drugs that get the credit, it's also these improvements you see in mycology, bacteriology.
In the first place.
Yes, you enable this.
Yeah.
And this fungal disease is basically the prototype of the improvement of modern medicine. Before, people did not have the chance to get a fungal infection.
Right.
They were dead from much more lethal pathogens, bacterial, but now we have made a lot of progress, and now we're making continuous progress even for fungal disease.
Fascinating work, fascinating research. again, my congratulations.
Yeah, thank you so much.
Thank you for being here, and all the best to you.
Thank you so much. Thank
Enjoy
you.
Madrid.
Thank you.
Thank you.
Thank you.